Imagine this. You're lying in a hospital bed, staring at the ceiling, knowing that in just a few hours, surgeons will open you up to remove a tumor that's been growing inside your body. The fear is overwhelming. The uncertainty is crushing. You've said your goodbyes, signed the consent forms, and now you wait. But what if I told you that some people never make it to that operating table? Not because they didn't survive, but because the tumor simply vanished, gone, disappeared, as if it was never there at all. Today, we're diving into one of the most profound and controversial intersections of faith and medicine, tumors that disappear before surgery, attributed by patients and families to the power of prayer. These aren't just stories whispered in churches or shared in support groups. These are documented medical cases that have left doctors scratching their heads, searching for explanations that science can't always provide. Whether you're a believer, a skeptic, or somewhere in between, what you're about to hear will challenge everything you think you know about healing, hope, and the mysterious connection between mind, body, and spirit. When a doctor tells you there's a tumor, time stops. Everything you thought mattered suddenly fades into the background. The diagnosis comes with scans, charts, measurements, and a treatment plan that often includes surgery. The tumor is real. It's visible on imaging. It's measurable. It's there. Families gather, prayers begin, and preparations are made. But for some patients, something extraordinary happens in the days or weeks between diagnosis and surgery. The tumor begins to shrink, or in rare cases, disappears entirely. Medical staff recheck the scans, thinking there must be an error. But the images don't lie. Where there was once a mass, now there's nothing, or significantly less than before. In medical literature, this phenomenon is called spontaneous remission, or spontaneous regression. It's rare, accounting for perhaps 1 in every 60,000 to 100,000 cancer cases, but it's documented. Tumors that were growing, spreading, threatening life suddenly stop, shrink, or vanish without medical intervention. Scientists have proposed various theories. Perhaps the immune system suddenly recognizes and attacks the cancer cells, or maybe there was an infection that triggered an immune response, or possibly changes in hormone levels affected tumor growth. But here's what makes these cases so fascinating and controversial. Many of them occur after intense periods of prayer, spiritual practice, or profound emotional shifts in the patient's life. When someone receives a frightening diagnosis, communities mobilize. Prayer chains form across churches, mosques, synagogues, and temples. Strangers add names to prayer lists. Family members gather in hospital chapels. There's something deeply human about this response to suffering, this reaching out to something greater than ourselves. And some patients report feeling this prayer like a tangible force. They describe sensations of warmth, peace, or even physical changes in their bodies. Skeptics might dismiss this as placebo effect or coincidence, but for those experiencing it, the feeling is undeniable. And when the tumor disappears, the connection seems obvious to them. Prayer worked. God intervened. A miracle occurred. Let me share with you one particularly compelling case. A woman in her late 40s was diagnosed with a large abdominal tumor. Surgery was scheduled for 3 weeks out. She was told the tumor was significant, potentially malignant, and needed to be removed immediately. During those 3 weeks, her church community organized around-the-clock prayer vigils. She spent hours each day in meditation and prayer, visualizing healing light filling her body. Her family never left her side, constantly speaking words of faith and hope. The day before surgery, the preoperative scan was performed as routine protocol. The surgical team needed updated images to plan their approach. But when the radiologist looked at the screen, confusion set in. The tumor had shrunk by more than 80%. The surgery was postponed. Another scan was ordered. Within 2 more weeks, the tumor was completely gone. The surgical oncologist, a man of science who had performed thousands of procedures, wrote in his notes, "Unexplained complete remission. No medical intervention administered." Before we get too far into the miraculous, let's talk about what science actually says. Research into the mind-body connection has exploded in recent decades. We now know that stress, emotion, and mental state can profoundly affect physical health. Chronic stress suppresses immune function. Positive emotions and hope can enhance it. Studies on prayer and healing have shown mixed results, but some research suggests that patients who are prayed for, even without their knowledge, sometimes show better outcomes. Other studies show no effect. The scientific community remains divided. What's not debatable is that the human body has extraordinary self-healing capabilities that we're only beginning to understand. The placebo effect alone demonstrates that belief can trigger real physiological changes. So when we talk about prayer healing tumors, we're really asking, can focused intention, belief, and emotional state activate healing mechanisms that medical science hasn't fully mapped yet? It's important to present the other side. Medical skeptics argue that many of these miracle cases have rational explanations. Sometimes initial diagnoses are wrong. Imaging can be misread. Tumors can be misidentified. Some tumors are naturally unstable and may grow or shrink based on factors unrelated to prayer. The timing of prayer and remission might simply be coincidence, not causation. And there's a darker statistical reality. For every tumor that disappears, thousands don't. Countless faithful people pray with equal fervor and still face surgery, chemotherapy, and death. If prayer reliably healed tumors, hospitals would be empty. Skeptics see these rare cases as statistical outliers being interpreted through a religious lens, not evidence of supernatural intervention. Doctors who witness these cases face a unique challenge. Their training tells them to seek rational scientific explanations, but their eyes see something that defies easy categorization. Many physicians, even non-religious ones, will admit they've seen cases they can't explain. Some become more spiritual because of it. Others maintain that we simply don't understand all the mechanisms of disease and healing yet. The wisest medical professionals seem to adopt a both-and approach. They don't deny the power of faith and hope while also continuing to pursue scientific understanding. They recognize that healing is complex, involving physical, emotional, mental, and yes, possibly spiritual dimensions. The best medicine, perhaps, is medicine that honors all these aspects of being human. Let's dig deeper into something crucial: the psychology of hope and belief. When a patient believes they will be healed, their entire physiology shifts. Stress hormones decrease, immune markers improve, pain perception changes, sleep quality increases. These aren't mystical concepts. They're measurable biological changes. Prayer and spiritual practice often induce states of deep relaxation and peace, similar to meditation. In these states, the body moves from fight-or-flight mode into rest and repair mode. Inflammation decreases, cell repair mechanisms activate, the nervous system rebalances. Could it be that prayer works not because a deity reaches down to pluck out a tumor, but because the act of prayer triggers the body's own profound healing capabilities? This doesn't make the healing less miraculous. It just suggests the miracle might be built into our biology rather than imposed from outside. Beyond the case I mentioned earlier, there are others. A child with a brain tumor that vanished between diagnosis and surgery after her entire school prayed. A man with pancreatic cancer, given months to live, who experienced complete remission after a pilgrimage to a holy site. A woman with multiple tumors throughout her body, who, after a powerful spiritual experience, saw them all disappear over several weeks. The medical files exist. The before and after scans are real. The doctor's confused notes are documented. These aren't internet rumors or faith-healing tent revival claims. These are cases that entered medical literature precisely because they couldn't be explained away. The question isn't whether these things happen. Clearly they do, even if rarely. The question is what they mean and what we can learn from them. Perhaps the most profound takeaway isn't about taking sides in a science versus faith debate. Perhaps it's about recognizing that reality is more mysterious and complex than either dogmatic materialism or naive supernaturalism allows. The human body is miraculous even without invoking miracles. The power of community, love, hope, and belief to affect physical health is real and measurable. And yet there remain cases, rare but real, that push against the boundaries of current medical understanding. For the patients who experience tumor disappearance after prayer, the explanation doesn't matter as much as the result. They're alive. They're healed. Whether you call it spontaneous remission, divine intervention, or activated self-healing, the outcome is the same. They get to live. So where does this leave us? Standing at the intersection of the known and the unknown, the scientific and the spiritual, the measurable and the mysterious. Tumors that disappear before surgery remind us that we don't have all the answers. They humble medical science while also showcasing the incredible capabilities of the human body. They give hope to those facing impossible diagnoses while challenging us to remain honest about outcomes that don't always match our prayers. If you're facing a medical challenge, by all means, pray. Gather your community, activate hope and faith, but also pursue excellent medical care. These aren't opposites. They're partners in healing. And if you're someone who's experienced unexplained healing, your story matters. It adds to our collective understanding of what's possible. What do you think? Have you or someone you know experienced unexplained healing? Do you believe prayer can physically change medical outcomes? Drop your thoughts, your stories, your questions in the comments below. This conversation is just beginning. And if this video opened your mind to new possibilities, hit that like button and subscribe for more content that explores the fascinating mysteries of health, healing, and human potential. Share this with someone who needs hope today. Sometimes the most powerful medicine is knowing that miracles, however we define them, are still possible.